Cameroon has taken the lead in the fight against malaria by becoming the first country to roll out a routine vaccine campaign for children. Malaria is the most widespread endemic disease in Cameroon, responsible for up to 2.7 million reported cases annually. Cases have been growing again since 2017 after tapering off since 2011. Cameroon is the first, but 19 other countries, including Liberia, are soon to follow with the vaccine. That's 6-month-old Daniela getting her first malaria vaccine. Daniela's mother, Hélène Akono, saw how tough it was for her older son to deal with severe malaria seizures.
I decided to vaccinate my children to avoid certain diseases because when they don't receive all their recommended vaccines, they can contract all sorts of diseases like malaria, catch a cold, or even get a cough. I always vaccinate all my children to avoid this.
The number of unreported cases of malaria is much higher than the 2.7 million seen by health officials annually. And malaria is one of the biggest killers of children under the age of 5 in Africa. But acceptance of this new vaccine is not straightforward. I've been speaking to my colleague, Paul Njie, who visited a vaccination center just outside the capital, Yaoundé, earlier this week. He began by describing the general response to the vaccine.
Cameroon became the first country to roll out the RTSS vaccine on Monday after the pilot phase in Ghana, Malawi, and of course Kenya. Some people welcomed the arrival of the vaccines in November and said that it's going to help curb the cases of malaria-related deaths among children in Cameroon. But on the other side of the aisle, we saw people who were skeptical about it. They expressed doubt about the safety and the efficacy. And we spoke to a couple of people, and I want us to listen to one woman who expressed her doubt in the vaccine.
Having vaccination, even at times when it is even declared publicly by the Minister of Public Health, at times they are having some after effects. I will not want my child to go in for any vaccination.
Wow. I know that vaccine skepticism has been a feature, especially since COVID-19. But what would you say is the reason why that lady was telling us that she won't go? Is it a lack of trust in the government? And is there an approach that the government is adopting in order to make sure that people actually do trust them and take their children for the vaccination against malaria?
Well, yes, Audrey, you did highlight lack of trust, and it's a very big issue here in Cameroon because some people say they are not very confident in the government's health policy. And like you rightly pointed out, during the COVID-19 pandemic, there was skepticism, there was hesitancy, and it all boiled down to some people not receiving their jabs. But I did interview the Minister of Health here in Cameroon, Dr. Malachi, and put this to him. Essentially, what government is doing, they are trying to encourage mothers to not heed those calls and try to vaccinate their children because it's very important. He said that they are not surprised by the skepticism. Let's take a listen to him.
Whenever you have a new vaccine, you will always have these anti-vaccine views, or those who are hesitant for the vaccine, saying several things that have no scientific basis. We do not have to convince them about something that is useful, something that is effective, something that should save our lives, but to reassure them about the quality of the vaccine and its performance.
Quant à sa performance.
Voici venue la prévention efficace contre le paludisme tant attendu.
So that's Dr. Malachi from the Cameroonian Ministry of Health. Paul, what happens if people are not willing to take the vaccine? I mean, is it choice that they can exercise or is it compulsory?
Well, so government is putting it out there for people to receive the vaccines. They are encouraging rather than it being compulsory. So that's why they're having campaigns trying to convince people why it's important. They're saying that malaria poses a great threat not only to children but even to adults. But basically, authorities are putting out there the risks attributed to malaria. But health experts also believe that the people are a bit reticent because they don't feel involved in the health debate and in the decision making. And that's the point that Dr. Albedze, whom we'll hear from, is making.
The
population doesn't feel involved in the big healthcare debates or in the research and production of healthcare goods and services. We naturally end up with a lot of people who are disengaged with what's going on. Sometimes we end up with vaccines that are already expired, at times due to poor preservation, and the population quickly only remembers what's negative.
That's Dr. Albedze. He's an expert in health economics.
Right. So how long will this rollout go on for? Is it a targeted program? Is it going to be rolled out across the country? We know that there's a part of Cameroon that are no-go areas at the moment because there's an insurgency going on there.
That's right. So this first campaign is to run from January to March. That's the first phase. But of course, it's a national program because it has already gone into Cameroon's expanded program on immunization for the year. And as the months go ahead, they'll keep vaccinating children. But you did raise a crucial issue about the rollout. It's going to be rolled out in 42 key districts across the country. Some of those areas are, like you said, conflict-hit areas plagued by insurgency. When we asked the Minister of Health what the strategy or the plan for delivery of vaccines in those areas, what the plan is, he said to us that they have a plan, but he cannot divulge that because it would be like putting out their own strategy out there in that kind of an area. But we also saw people coming out to receive these vaccines, though not as much as expected. We saw people who had confidence that this was a game changer because as you know, Audrey, 30% of hospital consultations are malaria cases in Cameroon, and every year 6 million cases are recorded with about 4,000 deaths. Most of those numbers are children under 5 years of age, so it's quite serious.
So is this vaccine program general or is it for children only? Is it for anybody who wants to be vaccinated?
No, so it's for children only, children who are 6 months, and they'll take it in 4 doses when they are 6 months, 7 months, 9 months, and 24 months. That's 2 years.
Right. Is this, I know the health ministry is involved in this, but is it a program that involves other agencies as well? And is there sort of a malaria-prone continent-wide plan? Because Cameroon is the first step in that.
Yes, so Cameroon is just one of the countries. The vaccines have arrived countries like Benin, Sierra Leone, and on Tuesday they arrived in Liberia. So it's some sort of a continental program which is ongoing, and they are supported by Gavi, that's the Vaccine Alliance, UNICEF, and the WHO. They are trying to ensure that they help these countries in the rollout of the vaccines. And for example, Cameroon paid about $66,000 for the first consignment of over 330,000 doses. And as they expect over 1 million more doses, they will be paying about $258,000, while Gavi will be supporting them with about $5.9 million to finance the vaccines. So they are getting the help from different partners.
That's Paul Njie in Yaoundé, Cameroon.